Nice to meet you. My name is Jung Bo Huh. Jung Bo Huh from South Korea. Yes, I'm working in Pusan National University, Department of Prosthodontics. I'm chair in this department. So today's lecture is second time in this year. Yes. Anyway, thank you for giving me this good opportunity to talk about my knowledge and my experience. Yet today's topic is the implant remove partial denture, based on this book. So this book was published in 2017 in English, Korean version, and then this English version published at 2021. Yeah. So 5 years ago, I made this subject in my university, and then every resident has to study this subject to become a specialist in Korea. So anyway, today I will introduce my knowledge about the implant remove partial denture. So basically, the fixed process is best, right? Yeah, fixed process with implant is best, but sometimes we have to make remove partial denture in edentulous patient who have general disease or lack of bone volume. So especially in Korea, there are so many old people who cannot get the bone augmentation or broad implant surgery. So at that time, we can combine the implant surgery and remove partial denture. So I will divide the several categories about implant-assisted remove partial denture, and then I will explain about the treatment strategy of implant-assisted remove partial denture. In some lectures, some papers, somebody said that those kind of treatments like implant combined remove partial denture, or implant supported remove partial denture, or so somebody said implant retentive remove partial denture. There are so many terms about this treatment, but today we have to understand the additional role of implant in remove partial denture. According to the role of implant, the name will be different. Okay? Totally, I called those kind of treatment implant-assisted remove partial denture. So, do you understand? So, I arrived today morning, so I have jet lag now. So, I beg your understanding. First of all, we have to understand the role of three kinds of function by the teeth or implant. Do you know those kind of terms? Stability, retention, and support. Oh, Ruben Kim? Yeah, he is the Professor Ruben in UCLA. He's a chair in restorative dentistry, right? Yes, thank you. He helped this book at that time. Yeah. Anyway, thank you so much. So, first of all, we have to memorize. We have to understand the role of these three kinds of functions. The first thing is support. Support is most important. What's the support? So that is the resistance from the vertical pulse. That is support. Okay? So when we bite something, the vertical pulse will be transferred to the edentulous area. So the resistance from the vertical pulse is the support. It's very important. Second important thing is stability. Stability is the resistance from the horizontal movement or rotational movement. Okay? Retention is the resistance from the pulling out vertically. So anyway, retention and support is the vertical movement factor, and stability is the horizontal and rotational movement factors. Anyway, using the additional implant, we have to reduce, we have to improve those kind of function in the removed partial denture. So what I mean, additional implant can be helpful to reduce the movement of removed partial denture. No? So through that kind of reducing of the movement, we can protect the surveyed bridge, surveyed teeth, and implant other surveyed other components. So if we insert implant, a small number of implant, those implants can improve those kind of functions, and the RPD procedure will be very simple using those kind of additional implant. Okay, do you remember three kind of things? Next memorizing is the movement of removed partial denture. In removed partial denture, there are only three movements. It's different with the full denture. We cannot understand, or we cannot know the movement of full denture, but in removed partial denture, only three movements will occur. So I will call this movement first movement, second movement, and third movement. So you have to memorize about this movement. Okay, first movement is the seesaw movement. Anterior and posterior seesaw movement. Seesaw movement, right? So if the foot push the posterior part, the second molar part, the anterior metal framework will be lifted. Oppositely, when you push the anterior part, the posterior part can be lifted. This movement is the first movement. This is very harm movement. Yeah, we have to reduce the first movement when we design the removed partial denture metal framework or other components. Second movement is the left and right side movement. Left and right side movement. So the patient bite in right side, the left side will be lifted. No? So those kind of thing is second movement. So this movement will be occur around the crestal ridge, edentulous crestal ridge. So when we push this part, this R point will be fulcrum line, the rotational axis, and make the opposing side lifting. This is second movement. You have to memorize. Third thing is when you see the upper side, when you see the RPD upper side, the movement can be occur like this. This movement is pendulum-like movement. Pendulum, is right? Pendulum in clock. Yeah. So only three movements will be occur. There is no another movement. So when we design removed partial denture, or when we make the implant assisted removed partial denture, we have to think about those kind of these three movement. Which movement do you want to reduce? That is the key point. So if you ask me, for example, you ask me about the patient wants only two implants, but where is the proper position? I don't know. The decision will make by you, by dentist. So the dentist want to reduce first movement, the position will be different. If you want to reduce second movement, the position also will be different. Anyway, three terms and three movement you have to memorize. Okay? I published 3 books concerning in terms of implant removed partial denture and implant over denture in Korea. So after publishing my books, this topic is very hot topic in Korea, and then every resident, every student are learning about the implant in partial denture. Why we suffer? Why we suffer to make implant to make or conventional remove partial denture? If we use a small number of implant, we can make very simple remove partial denture. No? Especially, we are not necessary to consider the exact position to make fixed prosthesis. When you make the implant assisted partial denture, you can insert implant in proper area without considering the finer fixed prosthesis. You know, so I will show with my cases. Anyway, surgery will be simple, price will be down, but we can make the simple limb partial denture. There is little complications of limb partial denture. So nowadays the price of implant is lower, right? Yeah. So in Korea the price is only I don't know exactly. Anyway, $50 implant. Yeah, for one implant. Especially over 65 years old, they can get government insurance within 2 implants. So they paid only about $200 per one implant. So the implant price is very cheap. So if dentist we can insert many implants to the patient, the fixed prosthesis is right. But all the patient generally have the general disease. Especially they don't want to get a severe bone graft procedure. So in that case, we can use those kind of treatment strategy. In my book, I divided 4 categories about the implant-assisted remove partial denture. So this is introduction. So I will show many cases in late slide. But you have to understand these categories. First category is the solitary attachment remove partial denture. Second category, bar type attachment remove partial denture. So we can divide the 2 kinds of attachment assisted remove partial denture. What's the difference between this one and this one? When you use locator, for example, when we use using the locator attachment can permit the movement, right? Movement. So we can say those kind of this type of remove partial denture, resilient type partial denture. Resilient. Is it right? I'm sorry. It's strange pronunciation. Anyway, resilient with movement. Yeah. Anyway, those kind of attachment permit the movement of remove partial denture. But if you use bar type attachment, the denture don't have movement. So we can say rigid type movement, rigid type remove partial denture. So these 2 concepts are totally different in terms of designing and making procedure in everything. Different, totally different. So which one is best? I don't know. To make those kind of remove partial denture, the number of implant will be increased, and then we have the implant will be spread with a wide area. But in this type, some part of remove partial denture push the soft tissue. So dentists have to permit those kind of movement. Yeah. So anyway, the concept was totally different between two types of attachment assisted removed partial denture. And this type is using the healing abutment, only healing abutment. So what's the meaning of healing abutment? As I told you, implant can give three kinds of function: support, stability, and retention. If you insert only healing abutment, healing cap on the implant pictures, that means you will give only support. Support, not retention, not stability. Do you understand? Yes. Thank you very much. Anyway, so for example, this patient only six anterior teeth, but after making the removed partial denture, the patient complained about the pain in the edentulous area whenever the patient bite. That means this removed partial denture has the lack of support, right? So we can insert short implant, 5 or 6 millimeter implant in the posterior part, and then we connect the healing abutment. And this healing, the top of healing abutment can attach with contact with the denture base. Okay, so this can give the increasing the support factor. If you use the locator, you decide to give enough retention, support, and stability. Everything can give using the locator type attachment. So I will explain the functions according to the attachments in later slide. Okay, so recently Korea is very famous to make the surveyed crown after implant surgery. Insert implant and then make the crown for increasing the aesthetic factor, or increase the supportive area. This one and this one is implant. In Korea, I always made the zirconia surveyed crown when I insert the implant. So because we can duplicate very easily after breaking or some problems. So recently, 10 years follow-up was published already. So there is no problems about that. Anyway, if you make the surveyed crown with implant, what did you give? What did you give to, what kind of function did you give to the implant? First of all, support, using the rest, occlusal rest, that is supporting factor. Stability, by the minor connector, and the proximal plate, other components, right? Give the stability. Second, you can give the retentive factor by using the clasp, like a conventional removed partial denture. So those kind of things have their own benefits. According to the design, according to the treatment planning, the total result and total final removed partial denture design will be different. So today, I will explain about 4 category treatment. So I'm so sorry, because of the limitation of time, I have to skip the basic of removed partial denture today. So I will explain the advanced treatment protocol today. Anyway, you have to memorize three terms: stability, support, and retention. And then you have to memorize 3 movement. First one thing is anterior posterior movement. Second thing is the right and left movement. Third thing is the movement when you see the upper side, upper aspect, right? Three kind of thing. So we had a better matching in each cases with the three movement. So when you see this kind of treatment, yes. So the patient have the unilateral residual natural teeth. Okay. So make the surveyed crown, and then I insert 2 implant and canine and first premolar area. So I connected the locator attachment. So what kind of movement will be occur among three kind of movement? First movement will be occur, right? When you push this posterior part, the anterior part will be lifted, right? And second, how about second movement? When I bite the right side, the left side will be lifted, right? But in this area will be positioned the clasp in natural teeth. So natural clasp will be prohibit the lifting action. Oppositely, when you bite this part, the second molar, the right part will be lifted, right? But some action can be prohibited by the locator, but in this part will be occur. So I want to mark the triangle about the second movement. How about third movement? There are so many minor connector and proximal plate here. Proximal plate 1, 2, 3 proximal plates. And then this locator also can give the stability factors. So third movement will not be occur. I don't know exactly. According to opposite dentition, the movement will be different. This time, there is no movement. First movement, will not occur. Second movement, third movement, everything will be fixed by the implant attachment. That is the bar time. Okay? This one. First movement, not occur. When you push it, the posterior part, these healing caps support the vertical force. So there is no lifting of the anterior part, right? But second, third movement will be occur. I don't know the exact amount of movement, but I'm explaining broadly now. So anyway, this case, there is no natural teeth in posterior part. We can say those kind of limb-partial denture is the tooth and tissue bone limb-partial denture, right? Yeah. So those kind of limb-partial denture have the three kind of movement. But if we didn't insert implant here and here, this patient have only anterior teeth. The movement will be increased compared with this design. Anyway, we after inserting 4 implant and then make the surveyed crown, the patient get the aesthetic merit, right? And second, we can reduce the amount of movement, 3 movement. So the patient can feel more comfortable. And then side effect will be reduced. Okay, I explained my concepts broadly, and then, okay. So in partially edentulous patient, we can make those three kind of concepts. First thing is fixed prosthesis. Fixed prosthesis is best. But if you want to make a fixed prosthesis, you have to consider the proper position of implant to make the crown with the ideal emergence profile. And you have to make the screw hole in the occlusal surface. So before inserting implant, you have to do bone grafting procedure or soft grafting, connective tissue grafting procedure. Anyway, to make fixed prosthesis, you have to consider many factors severely, right? But the patient don't have enough money, or the patient have the general disease, or other because of other factors, somebody can get the conventional removed partial denture like this. But as you know, if the patient have only anterior teeth, we can many experience about side effect, soreness, pain, broken. Anyway, we have to repair many things for a long time. So third concept is the implant assisted removed partial denture. Additional implant. For example, in Korea, we like to insert only 2 implants in edentulous patient, partially edentulous patient. When we insert 2 implants, we consider the support area and then final product of removed partial denture. And then we can insert implant properly without severe bone augmentation. But after insert implant, we can reduce the movement of the removed partial denture. This case was from my resident, 3rd grade. I'm a prosthodontist, so in Korea, prosthodontists can insert implants severely many times. Yeah, so especially I always planned the implant position using the guided surgery systems. So anyway, without guiding surgery, my students insert implant like this. So after insert implant, we can decide the final prosthesis. So the final decision was fixed prosthesis. Why? Implant position is proper to make the fixed prosthesis. Look at this occlusal part. First of all, implants have the similar path. Second, the hole, screw hole, were located in the occlusal surface. That means we can make the proper emergence profile of fixed prosthesis. We have to consider the emergence profile and then embrasure space between the teeth. We have to consider the proper cleansing of the fixed prosthesis. But if the screw hole locate another part, for example, this one, interproximal area, or buccal area, or lingual area. So at that time, we cannot make the fixed prosthesis properly. So those kind of implant fixation make the poor-shaped final prosthesis. So it's very difficult to clean, and then maintenance. Look at this slide. My oral surgeon insert 6 implants like this. When I see the view, the intraoral view after surgery, I surprised. Oh my God! The surgeon showed only cartilage, bone cartilage. When you see these pictures, you can say like this: "Oh, the implant surgery was perfect." But prosthodontist, I'm so sorry to patient. Although the patient have the 6th implant, but we have to make the removal time. Why? Oral surgeon, This is, okay. I cannot find, okay, mouse. This is residual bone. And the surgeon insert implant like this, showing the only crestal ridge. But the final process, final crown have to position this part. So the surgeon insert implant properly, showing the crestal ridge. But the original tooth have to position like this. After extraction of the teeth, the alveolar bone will be reduced. But if surgeon showed only crestal ridge, the implant positioned palatally. So we cannot proper shapes of final processes in buccal aspect. So I made a bar, build bar. Look at this picture. Build bar means the artificial ridge. The original ridge had to position in this part, but implant positioned palatally like this. So I made a bar to the laterally, more laterally. So you have to remember, bar have to prohibit every movement, rigid type processes. So the bar have to position the artificial alveolar ridge. So we have to make the artificial alveolar ridge using the bar. So if the surgeon didn't want to bone graft procedure, the surgeon have to tilt the implant labially. Do you understand? The razor point is not indicated this monitor. If the picture tilt like this, labially, buccal aspect, tilting insertion will be helpful to make the proper final processes. Anyway, what I mean, you have to see the final processes, and then you decide the implant position.
So, sorry, Dr. Ho. So this can be avoided by using the surgical guide.
I show next slide. Although you use surgical guide design may be performed by the dental technician or company man, right? So they cannot see the proper final processes. Anyway, although when you use the guided surgery system, final decision have to done by you. The angulation is very important. So many dentists think about the parallelism of the implant, but it's not important to us. Why? Because we can use the customized abutment and then digital technology for making the final processes. So we have to tilt properly. And then I make the overdenture type final processes. Although I made overdenture final processes, but the shape was totally different with the resilient type overdenture. It's very typical concept. But anyway, resilient type overdenture have to wide denture base and thick denture border to get the sealing and to reduce the denture movement. But in the rigid type, we can reduce the thickness of the denture base, and then we can reduce the length of denture base. This pink color's denture base is for getting aesthetic factors and getting the artificial teeth. So there is no movement in this denture, but the patient have this zirconia fixed processes in lower jaw. So I covered these teeth with the metal. But to be frank, in American people, it's not necessary to cover. But in case of Korean, they have the heavy jaw function, heavy pores. So if I didn't cover this artificial teeth with metal, the artificial teeth will be broken. Yeah. So according to the people and racialism, right? So treatment will be different. Yeah. Anyway, but you have to think about the resilient type and rigid type. This is rigid type. Every biting pores will be transferred to the implant picture. So when you make the rigid type overdentures, you have to consider about the metal structure to enhance the strength. So I covered the bar with metal, and then I made the enough metal component to make the major connector, and covered the occlusion with the metal. That's because this is similar with fixed processes, not removable, to be frank. But the patient can remove, but the function, in aspect and function, this type of processes is same with the fixed processes. So every pores will be accumulated to the picture or processes. So we have to enhance the process structures by using the metal or other ductile materials. Okay. So there are so many articles about IARPD. I will call implant assisted partial denture as IARPD. Okay, IARPD. So many articles said that. Last one is my article. Anyway, stable and reliable occlusion. We can get a stable and reliable occlusion using a small number of implant in the partial denture. Second, there will be good retention and aesthetics, improved masticator function, and improved satisfaction of patient. No extensive surgical procedure. So, if the patient over 70 years old and the patient have diabetes or some problems in their body, so although they can pay enough, but we can reduce the treatment planning like this. You can get 2 or 3 implants in edentulous area without bone augmentation. And we can reduce the surgical procedure, but we can make the stable remove partial denture, and then IARPD can helpful to repair in future. If your picture, one of your picture pulling out because of peri-implantitis, we can use this remove partial denture continuously. Anyway, my goal when I treat those kind of things, I always think about the patient quality of life. Yeah. So the patient, for example, the patient can live only about 10 or 20 years, for example. So at that time, I can give the chance to repair of the removed partial denture. Yeah, and then I can give the comfortable removed partial denture for them. But fixed process is best. Yes, if the patient get fixed processes, you can do that. You have to do that. But the patient don't have enough teeth, enough bone, and then you can insert the proper position, and then you can change the remove partial dent design. I will skip everything because I explained already. So look at this picture. This is very important. So today, I want to emphasize the role of attachment. According to attachment, the role is totally different. If you used O-ring attachment, or if you use magnet, or if you use locator, the function was totally different. What kind of movement do you want to reduce? That is key point. So if you use healing cap, that can give only support. Okay? If we use the locator attachment can give support, retention, and stability. But do you know the principle of locator? Locator have the 0.2 millimeter space between female and male part. When you push, the patient biting something, the denture push within 0.2 millimeter. You know? And then push the attachment, male part. There is no pictures. Anyway, and then in case of locator, have the 8-degree pivoting movement. Over 8 degree, over 8 degree, the locator pulling out automatically. They cannot stay in the male part. Anyway, locator have the movement. 0.2 millimeter vertical movement and 8 degree pivoting movement. So anyway, locator have the 3 kind of function: support, stability, retention. So when you see the first case, there are some problems. What kind of problem? If you use locator, the implant have to have similar paths between 2 implants. You know? It's very confusing factor. Some company men say like this: locator can compensate over 60 degree, but it is the full denture case. For example, you insert 2 implants in here, and then you push the denture. You can insert like this, 찌걱, right? But remove partial denture, the guiding path, inserting path is decided from the natural teeth already.
That makes sense.
Yes, do you understand? So the remove partial denture cannot insert 찌걱. Remove partial denture have to insert passively, 쭉, have the same path with the. So if you want to use the locator, you have to match with the passive insertion of natural teeth, and you have to match between implants. It's very difficult case. But when you see this case, the locator is diverse each other. And in that case, locator wear will be increased. So within 2 or 3 months later, you have to change the locator, matrix part. If you make the parallelism between implants and passive insertion of partial denture, generally the locator will be maintained over 1 year with only 1 plastic cap. So you have to consider about the path, about when you use the locator, okay? And then this case, what kind of function of the PO implant? Anterior 2 implant can give the support using the healing abutment, right? But there is no function of retention. Posterior 2 locator can give the retention, support, and stability. You know? If you make the rest in these teeth, you can give the support in these natural teeth. If you make the clasp and last seat, you want to make the 3 kind of function, everything: support, retention, and stability. No? Yes. Anyway, this case report was not mine. So in your country, American reported that those kind of things. But at that time, they published about 2008 or 9. Last thing is my paper. Anyway, they didn't consider about the function and the lore of the removed implants in IARPD. Because of that, I wrote this book. If you want to add additional implant, you have to consider the function. What kind of function do you want to give to the implant? So it's very important. So third thing, the healing cap can give only support, right? Yeah. I explained about everything. So you listened to last my lecture, right? Yes. So I explained about bar type zirconia processes at that time. So nowadays, Korea OSTEM company, in America Hyoseng company, and ADD-TOC company and JM company, yes. Anyway, is treating the bar and zirconia processes nowadays. Yeah. So, but this concept is very old concept. So very long time ago, many specialists make those kind of processes. So anyway, you can use the bar and clip, and bar and magnet, bar and O-ring. You can use everything. You have to forget old concept. In originally, bar could get the retention from the friction 10 or 20 years ago. You know, there is no dedicated attachment for bar. But nowadays, we can use several dedicated attachment in market. Locator type, Electro attachment that was developed by me, magnet, O-ring, and clip. There are so many things. So, but according to the attachment, additional attachment, the roller is also different. This concept is by me. Anyway, I made the build bar with using the CAD/CAM technique, and then I always connect with the changeable attachment. If this attachment wear, I can change very simply. So in the bar, this upper part can give the support, right? When you buy something, the upper part of the bar can give the support. And then axial wall can give the stability. When the process is tilting or rotational movement, the axial wall can prohibit. But retention is from the attachment, not friction. So when you remove this attachment, the process is a soft, passive fit. No? There is no retention. After opposite side, the model make the opposite side, the final process will be pulled down. No? Yeah. Retention factor have to get by the attachment. But attachment will be where, so we can make we have to use the changeable attachment. There are so many things in market. And I've heard that in America, those kind of this kind of treatment was not performed until now. So, but in Korea, there are so many clinical reports about the implant sorbate crown case. So after insert implant and then make the sorbate crown in the anterior part or to get more functions by the implant. So in this patient, I insert 2 implants in canine and burst premolar and I made the sorbate crown. Then I make the rest seat here and projection plate, and then RPA. Do you know RPA? I don't know the exact term in America. Anyway, RPI system, RPA system. Do you know that? Okay. So I made RPA to permit the movement in posterior part. So if I have chance in future, I will prepare the basic of the remove partial denture concept. So anyway, today I have to skip. Anyway, from the rest we can get the support. From the proximal plate and the minor connector we can get stability, and then by the clasp we can get retention. So from these surveyed crown we can get every function: rest, stability, and retention. I will skip everything. So there are so many articles about the implant assisted partial denture in case of using attachment. There's so many articles. These are all mine. Yes, sir. So anyway, nowadays there are so many clinical review articles. So the success rate is proper compared with the fixed processes. So anyway, so I skip. Implant surveyed remove partial dentures evidence is lack until now. So in Korea, we published several researches, 7 years researches until now. Seoul National University and Pusan National University published several articles about IRPD. And based on my research, I published 2 books about the implant remove partial denture. So nowadays in Korea, IRPD is very natural things, very common things, especially surveyed crown making procedure is very, there are some problems in Korea. To get the government insurance, the patient have to make the crown after insertion picture in Korea. So those kind of treatment have been developed. But after treatment, we can get proper result. You know? And then there is those kind of process make the less side effect of the conventional remove partial denture. Easy repair, easy maintenance. So there are so many merits when we treat implant assisted remove partial denture. So this is my paper. So 3 years ago, I published this book in JPD. At that time, editor asked me. He said that he said like this. I want to. You had better recommend the proper position for IRPD with the implant surveyed crown. So at that time, I don't have any evidence base about that, but I made the rule to proper position. First thing is symmetry. Symmetry. For example, in lower case, this side have the natural teeth. I make the symmetry. I make opposing. I insert the opposing side with symmetry. No. And second thing is the contact point. Making the contact point between upper and lower jaw. So I made 2 principles to make the implant assisted remove partial denture with surveyed crown. So asymmetry, symmetry is very important to increase the stability. No? Yeah. And then contact point between upper and lower jaw is very important factor to maintain vertical dimension. Do you understand? Yeah. If I didn't insert 2 implants in this area, these natural teeth have to contact with the denture, artificial teeth. After wearing the artificial teeth, the vertical dimension will be changed. But I made the palm vertical contact point. The vertical dimension will maintain long time, for a long time. Yeah. So I wrote like this. And then this sentence referenced many articles and many case report right now. After my report, there are so many articles about implant origin removed partial denture. So I will skip. Can I proceed only 15 minutes ahead? Yes, after 15 minutes we will get break time. Okay. Okay. So this is conventional removed partial denture. This is implant assisted removed partial denture using posterior implant. Only 2 posterior implants can increase the patient satisfaction. What's the reason? If there is no implant, whenever the patient bites something, the vertical pores hurt the soft tissue continuously. To prevent those kind of symptoms, we have to do regular relining. No? But I believe between Korea and USA has similar situation. The patient don't want relining, don't want to get relining, especially dentists don't like to do the relining technique, right? Yes. So because of that, I wrote relining books. Next month will be published. Anyway, relining is very important, but if you don't consider about regular relining, you have to insert 2 implant picture in posterior part with a short implant. And then you can prevent the burst movement. So the patient masticatory function will be increased. And then they will reduce the sore or pain on the soft tissue.
Doctor, when you say 2 implants, you mean 1 of each side?
Yes, right. Like this. So this is very important concept. You have to understand the function of implant processes. First of all, okay, let's imagine you insert 2 implants in the second molar area using the short implant, about 5 or 6 millimeter length, okay, because of the lack of vertical bone. So first concept is using the healing cap. This one, like this, healing cap. You have to see with consideration, right? These pictures. This is the cap of the denture. No? This healing abutment. The top of healing abutment can contact with the denture base, but the actual wall have to get relief. For example, this is implant, and then the denture base hold the healing cap. Whenever the lateral pores and then rotational pores, the implant cap have to resist their rotational movement. Because of that, the frequent healing loosening, yes, right, or fracture of the healing abutment. So if we use the healing cap, this function is the healing cap's function is only support. So you have to make the relief in side aspect of the healing cap. That is very important. And for example, you insert implant like this, tilting in the posterior part, and then the denture base have to contact like this. So it's very difficult. So according to my books, you can grinding the healing cap with a rounding form. Understand? Yes, I will show next time. So, if you use the killing cap, the burst movement can be prohibited. No? You can remove the burst movement. You can prevent burst movement when you use the killing cap, right? Do you understand? But second, third things, no. We cannot prevent. If you insert implant and then you made the surveyed crown, like B, although you make the surveyed crown, you can banish the clasp or indirect pressure plate. If you make only last, the function is similar with A. You know, if you make the clasp and reciprocal arms, you can give the stability and retention factor in this crown. So if you make the every clasp assembly, the movement will be prevented. Every movement will be disappeared. So we can those kind of designs like tooth bone remove partial denture. Teeth bone, yes. There is no movement. Every movement will be prohibited by the natural teeth or implant crown. But if you remove this clasp, you gave only support, not retention. Okay, so this is very important consideration. If you insert only 5 millimeter short implant, insert only short implant, the short implant have the weakness, right? But so you can remove the clasp to prevent horizontal movement, horizontal prevention force, right? Preventive force. So anyway, this choice will be made by you, by dentist. Dentists have to select the design of the final processes, not dental technician, not your assistant. You have to consider the denture movement and then change the design of removed partial denture. If you use the locator, you can prevent 3 movement. But you have to consider about path of insertion of partial denture. As I told you, you have to make the similar path between implant, and then this insertion path have to similar with the guiding plane. When you insert the removed partial denture, the denture definitely have the path of insertion. The implant have to insert similar with the path of insertion. At that time, the locator will be lasting long time, for a long time. Okay? Yeah. So, although you insert the same position with only 2 implants, but according to attachment, according to final processes, the function and the movement will be totally different. That is the key of my lecture today. Yes, okay.